Hello everyone, and welcome back to my channel. So if you're new here, you're welcome. My name is Love Manga and I live in Taraba State, Nigeria. um Please don't forget to subscribe to this channel. It's very important to me. If you've come across this video or if you've been watching any of my videos and you've not subscribed yet, please subscribe. It's very important to me. Thank you for all those that have subscribed, have been watching my videos and commenting and encouraging me. I'm very much grateful. Okay, thank you very much. So today I'll be talking about this baby here. This is Tretinoin. The camera is bad. I would have tried to focus, but I can't seem to get a good focus on it. I don't know if it's the light or what, but this is Retin-A, right? This is tretinoin cream, 0.05%, and basically this is vitamin A, topical vitamin A, that is used for the treatment of acne. So this vitamin A comes in either a topical form like this, where you can just rub on, or it also comes as tablets, which is like oral tablets, which is Accutane. um that's used for very severe acne, okay, and in some cases leukemia, but that's not what we're talking about today. We're talking about using tretinoin for acne, for scarring. You know what, there are some cases of acne that you've had acne for a while, and you develop some kind of scars that don't leave. Tretinoin is very good for it. Hyperpigmentation, when you have acne and it heals, or probably you touched it and before you know it leaves spots on your face, right? Tretinoin is very good for that. It encourages renewal of skin scales, shedding of dead cells, so that the topmost part of your skin is shed away, and the one underneath, which is fresh skin, clear skin, it's now revealed. So acne is tretinoin is very important for acne. It's one of the main treatments that your dermatologist will prescribe for you if you've probably gone through a lot of over the counter medications and it has not worked for you. Tretinoin is one of those baddies that will be prescribed for you, and it's very effective. I know that, let me not say I know because I've not traveled anywhere outside Nigeria yet, but I think outside Nigeria, as I've read, this is only prescribed. But I live in Nigeria, so um we're able to get this over the count, like in stores. But though the percentage is not much, I think that there's a percentage that you may not be able to get on the market. This is 0.05%. It comes in, what I've seen so far, it comes in three percentages, right? Comes in 0.025%, then this, which is 0.05, then I've seen 0.1%. I've not seen any percentage higher than that, right? So these are the percentages that it comes in. So very importantly, right, um how do you use this tretinoin? How do you use tretinoin, and how effective it is? Tretinoin is very effective, but it's one of those ingredients that you have to be patient with to see results, because unlike other medications that probably in a few weeks you'll be able to see very good effect, like maybe benzoyl peroxide for instance, maybe in a few weeks you'll be able to see results, or few days, you see your acne drying up and all that. But tretinoin is a more, it takes longer for you to see results. So whenever you want to use tretinoin, you have to be patient, because you will not see results in like 1 week or 2 weeks. In short, your acne may become very worse, like when you start using it, right? So this takes a while, at at least when you want to use tretinoin, give yourself like 3 to 6 months to be able to see good results with tretinoin usage, right? And then, there are some precautions to take while using tretinoin. I think one of the main issues why tretinoin needs to be used with caution is because there are some regulations that come with using tretinoin, and most of those regulations, let's say Africans for instance or Nigerians, most people don't even know what's like what sunscreen is. They don't know what like moisturizing their face is. They don't know how to, like when you say no, don't use this during this period or whatever, and the person still goes ahead to use it, and it may cause some harmful effects because it is teratogenic. So if you're pregnant for instance or breastfeeding, you're not supposed to use tretinoin. Though I've seen several researches talking about how that um, there's been no research that has actually linked topical tretinoin with any kind of like child or let's say infant, um, what do you call, any kind of malformations or whatever, or impact on a child. But better safe than sorry, especially I've read somewhere, especially in the first and second trimester, right, where the child is still developing and all that. It's very very important to stay off of tretinoin, my dear. Your face cannot be more important than your baby, right? It's better to make sure that your child is safe. I think that should be the most important thing for any mother at that point. You can look to other ingredients like benzoyl peroxide, glycolic and salicylic acid, lactic acid and mandelic acid and all those other stuff rather than tretinoin. Probably when you put to bed you can think about that. Then what to note is that you have to be careful to use your sunscreen, right? Because this particular ingredient, it increases your sensitivity to the sun, right? So if you don't use your sunscreen while using tretinoin, like there's no need for you to be honest, right? There's no need to use tretinoin if you don't use a sunscreen. That's just basic. If you know you're not going to use your sunscreen like very well, don't even just use tretinoin. Just probably just leave the face like that, okay? But if you're going to use tretinoin, you have to get a sunscreen, okay? But it's very very important. Then what else? You have to use a moisturizer because tretinoin can be drying, so you need to get a moisturizer to go over it. But the thing is, depends on what kind of moisturizer you want to get, right? That will be a topic for another day probably. What kind of moisturizers should you use with your tretinoin? That's if you're interested in me talking about the kind of moisturizers that will go well with your tretinoin. Leave a comment for me and I'll be sure to do a video about it next, right? So usage, how do you use this, right? So this is used best at night. Best at night. Use it at night. Don't use it during the day when your face is interacting with the sun and all that. Please use it only at night, okay? So use a gentle cleanser. If you have makeup on, just make sure that you take it off completely. Use a gentle cleanser like CeraVe or Cetaphil, any of these. Just a gentle and mild cleanser, or simple, just a gentle basic mild cleanser with no active ingredients or whatever. We just don't want any other thing that will just interfere or make the surface harsh, because this is already a very strong medication like we've said. So get a gentle cleanser, wash your face, make sure your face is clean, make sure it is dry. Then you just use a very very small amount is okay. Just a peanut, like a peanut amount is okay. You don't need to go too much over it. Just a little is enough. Just put a dot here, and rub it in. Then allow to sit for about 10 to 15 minutes, then you go on with your moisturizer, okay, and allow that to sit for a while, then you go to bed. When you wake up in the morning, you cleanse your face with a gentle cleanser still. Go ahead with your morning skin routine, whatever that may be, whether benzoyl peroxide or salicylic acid, whatever you use. But make sure that within this period you're not using too many harsh active ingredients. I would prefer you don't even use any active ingredients like every day, maybe once or twice a week. Exfoliation, that's okay, but not every day, right? So once you cleanse your skin, go on with your moisturizer, go on with your sunscreen, and you're good to go. Give it a while and you'll see the magic. I think this and benzoyl peroxide is what saved my skin, right? These are the baddies, like these are the things that I used that I really saw improvements in my acne. I'll talk about benzoyl peroxide probably another day. If you're interested, just put up a comment so that I'll know you really want to, see something like that. But basically, that's all I'll talk about Tretinoin today. We can talk about what moisturizers or what cleansers or whatever that has to do with retinol, but this is all I have for today. Okay, so thank you very much for watching this video, and I'll see you guys in my next video. Please don't forget to subscribe, like, comment, and share this video with your friends and your loved ones. Thank you very much, and bye bye.